The Mississippi State Department of Health recently named a new state epidemiologist, and we are delighted to have with us Dr. Renia Dotson, the first Black woman in the role. How are you doing, Dr. Dotson?
I'm well. Thank you for having me, Tanya.
And we are delighted to have you. How excited are you about your new role?
It's very exciting. It's very challenging. Hit the ground running and learning all of the new things, but most importantly, being able to serve the people of Mississippi gives me a great lift. So I'm looking forward to the role.
All right, so we got to talk about the flu. West Union Attendance Center actually shut down because 200 kids called out sick. How bad is the flu activity in North Mississippi?
In North Mississippi and in your area, Northeast Tupelo, Oxford areas, we've seen an increase in the rate of the flu in the areas where we surveil, where we have people who report to us. And your rate now is at 14%. You're like the third largest increase over the last week, with Delta having the highest rate, and then the Metro Jackson area having the next highest rate. The state's overall rate of influenza is 8.7%, which is above the national average at 6.4%. So I would say that we are in a spike at the moment.
Okay, and when it comes to the flu, are you getting any kind of pushback, especially when it comes to parents filing the religious exemption to not get their child vaccinated?
Well, as far as, we pretty much honor most requests, religious requests for exemptions. So from our standpoint, there is no pushback with that. If a parent applies, then we go through the necessary paperwork, and we try to accommodate them when and where possible.
Oh, okay. But when it comes to vaccines, what is the message you have for parents today who may be on the fence about making sure their child gets a flu vaccine?
For those parents, I'd say that the most effective way we have at preventing the flu currently is through the flu vaccine. For the most part, they are safe. Occasionally there are some people who have side effects from those vaccines, and we take that into account. We certainly encourage the vaccine. However, if it does not fit with their lifestyle or their choices, or if simply there are some people who do have true medical exemptions from vaccines where they just can't take it for a medical reason, then we recommend that you just try mitigation procedures, cleaning and disinfecting surfaces, high touch areas in your home. If you have sick individuals in your home, if there's a way for them to quarantine themselves away from the rest of the family to keep them spread. If you're sick, stay home, and just be mindful when you're out in public of high touch areas, washing your hands, keeping your hands away from your face and mouth and eyes.
Mm-hmm. Now, is it still too late to get the flu vaccine?
It usually takes about 1 to 2 weeks for it to actually become truly effective. So I would not discourage anyone from getting the vaccine. I don't think you can run in now, certainly not after you start having symptoms. Mm-hmm. And you get the flu vaccine and expect it to be helpful or therapeutic at that point. If you are feeling sick, though, we encourage you to visit one of our county health departments, where we do have available both flu testing and COVID testing, and we have the ability to treat patients who test positive for the flu with Tamiflu. So I would encourage you at the beginning of symptoms, if you think you may have the flu or you're symptomatic, just visit one of your local county health departments and get tested.
All right. Well, thank you so much there, Dr. Dotson, for joining us this afternoon. A pleasure seeing you as always.
All right. Thank you.